I am Dr. Jay Hitson with Blue Umbrella Medical Center, where we have innovative, integrated health solutions. We do a lot of work with neuropathy, and technology has become a huge part in our therapies and our treatments when we are working with neuropathy. Now, first of all, neuropathy is a neurological condition that usually affects the feet or the hands, burning, numbness, tingling, a lot of pain. A lot of times people have a difficulty balancing, walking, and it is a progressive condition. So our goal is to not only prevent the symptoms from getting worse, but reverse the condition before we get to the point of either permanent disability or even amputations. Now, with regards to some of the technological advancements with neuropathy, there are a couple. I'm going to talk about one today called electric cell stimulation. Let's just say that 5 times fast. Electric cell stimulation. Now, there's a lot of different things that are out there and a lot of different claims with regards to neuropathy. We have chosen this particular technology, one, because it just really works. 2, it's very non-invasive. It's pretty simple. There's no downtime. It's relatively a passive therapy, which means like the patient doesn't have to, do a whole lot. They, you pretty much will just sit there while the machine does the work. And whenever we're kind of looking into the different therapies, it also matters that insurance does cover this particular therapy. So whenever there's the realm of different options out there, and there's a lot of good ones, but they're just not covered by insurance, and finance is an issue for a lot of people. So we've opted this way. And a lot of our patients have been very, very grateful to have that ability for insurance to cover it. So to understand electric cell stimulation, first of all, the problem with neuropathy is that there's the nerves, specifically the myelin sheath. So if you were going to, the myelin sheath is like this outer layer around the nerve that kind of gets deteriorated or eaten away. Now, the key thing is, we need to grow that back, all right? And it does grow back, it's just really slow. And the problem for a lot of people is the thing that's damaging the nerve is damaging it faster than the body's able to repair, and that's why it's getting worse. Now, it can grow back though, and it just needs a little help. It needs specifically resources. Anytime you're trying to grow anything, it needs fuel, it needs resources, it needs, plants need water and they need their minerals and their nutrients. Human beings, we have to have resources, we have to have nourishment, hydration, all of those different factors. So specifically with electric cell stimulation, what it does, or the problem with neuropathy, is that those resources get dammed up. So instead of all of that flow being able to get to where the problem is, it's getting stopped and it's getting plugged up. And electric cell stimulation, it's able just to kind of, blast through those dams and in floods all of those minerals and nutrients and vitamins, and it starts to come back. It's really a phenomenal technology. Now, in and of itself, this can get some really good results, but I'm going to say by itself, it's kind of mid-grade. When you put it into an integrated approach though, and you use like the nutritional components, and you do some of the other therapies, and you also address what's causing the neuropathy, and you put out, that takes it from mediocre to a miracle. And that's what we're really about here, is we don't want to just kind of make things a little bit better and a bit more tolerable. We really want people to get back to their lives. So we use this more integrated approach. So there are times whenever we have different patients who come in and they just want that one particular technology. They've heard good things about it. And we go and redo their assessment, and we find out that there's a lot of things that are still causing the problem, and there's some underlying issues. And frankly, we will just tell people that they're just not really a good candidate for only one technology, only this one technology. They really need to do the whole approach. They need to do the entire treatment. And again, it just makes a lot of good sense, because we care about getting results for our patients, and we don't want anybody to get discouraged. And furthermore, to have used up their visits, their insurance paid visits, and then find out they should have done the rest of the program, and then now we can't get them that treatment because they've already used up their visits. So there's just a lot of reasons why we want to make sure that we are getting every single patient everything that they need in order to just get the best results possible and get their lives back, be able to sleep at night, be able to walk, be able to do the things with their family, their friends, travel. Whatever adventures still lay out there, we want that for our patients. And so that's why we recommend like the wholeness of this treatment plan, not just the new fad technology that's come out, because that's not where it's at. So that is us, Blue Umbrella Medical Center, innovative, integrated, but it's health solutions, not health cover up the symptoms. And anyway, I hope that this is an encouragement to anyone out there who has been suffering for a really long time, maybe hasn't gotten the results that they're looking for, and is ready to give it another try, because you know what? It's worth it.